After less than 2 years in position, CEO of William Osler Hospital in Brampton, Dr. Naveed Mohammed, quits. Dr. Naveed took the charge of expanding Brampton's hospital capacity in his role as CEO of William Osler during the pandemic. And while Brampton's only hospital suffers from lack of beds and facilities to accommodate all the patients, Dr. Naveed's resignation brings more challenges for the already crumbling health system in Brampton. My name is Pragya Devan and you're watching Voice News Network. And let's talk about the current state of William Osler Hospital in Brampton, Ontario. Let me tell you, William Osler is the only full-service hospital in the city of over 600,000 that has been a hotspot of COVID-19 during the pandemic. Dr. Naveed's resignation comes at a time when William Osler is already dealing with many controversies. Last month, the hospital declared a code orange when the number of patients exceeded the amount its staff could handle. Meanwhile, Peel Memorial's Urgent Care Centre was also forced to close amid the Omicron wave. Many slammed the hospital authorities for failing to provide healthcare to the residents of Brampton. The situation is so worse now that the residents of Brampton may have to raise $125 million for its own hospital expansion.
We had Osler's partners at council. They did say that the province is putting $1.1 billion, and it's going to be a full emergency, 24 hours, 7 days a week, with 250 beds, plus an extra 100 beds in case it expands. Also, they're putting a cancer treatment facility there, which is very important. So the hospital will be about $690 million. And the cancer treatment is about $396 million, so it adds to about $1.1 billion. Every hospital, most hospitals, we have to come up with 10% of the construction costs. We did that to our last hospital that's here in Brampton, the last council. I was not there before. They're a levy, and we have to come up with $125 million. So I know North Bay, they got $1 billion in their hospital. They paid zero for the tax residents. But you can't compare North Bay with 55,000 residents, expect them to pay $125 million. But I think we have to step up because our hospital is very full. We have to do our share.
Dr. Mohammed had worked with Osler for decades, beginning as an emergency physician at Etobicoke General Hospital in 1997. In April 2020, Dr. Mohammed was named to 2 roles for the health organization which manages Brampton Civic Hospital, Etobicoke General Hospital and Peel Memorial Centre. His appointment as CEO of William Osler was a big news, especially for the South Asian community. Dr. Mohammed's sudden removal from the position of CEO raises a lot of questions that pertains to the functioning of William Osler. The provincial government included in its 2021 budget a commitment to build a new inpatient wing at the Peel Memorial Centre in Brampton, a healthcare facility opened in 2017 that does not currently qualify as a hospital. But details in the budget itself are sparse and include no reference to a dollar figure for the project, a proposed timeline, or even a description of services that will be offered as a part of the expansion.
We're building a new hospital for the people of Brampton. This hospital will include over 250 new patient beds. It will include a 24/7 emergency department. This will be an amazing state-of-the-art healthcare facility. The new hospital, the city deserves, and this modern new hospital will help us keep up with the amazing growth in this area. And I hope that one day we will have doctors working in this hospital who are trained at the new medical school right here in Brampton. Wouldn't that be amazing?
If we talk numbers, the city of approximately 600,000 only operates one hospital, the William Osler Health System's Brampton Civic Hospital. The emergency department at Brampton Civic receives an average of 130,000 patients annually, despite being built to handle only 90,000. Estimates cited by Brampton and healthcare groups say that the city needs at least 800 additional beds to serve its current population. And while we hear news now and then about the hospitals in neighbouring cities of Brampton like Mississauga keep getting the funding for their hospitals, Brampton is still left in the lurch when it comes to dealing with the ongoing health crisis in the city.
I just can't believe how quickly it's happened. Promises made, promises kept. And I want to thank our residents and city council members for supporting this Fair Deal campaign. I know Ministers Sarkaria and Amarjot Sandhu are hardworking members of Provincial Parliament. We're hearing our concerns. They know our community has not previously received our fair share of financial support for key priorities in our city. And I want to thank Health Minister Elliott and Finance Minister Peter Bethlenfalvy for meeting with us and taking our phone calls. We were a little bit relentless in talking about our healthcare challenges. In Ontario, the average number of beds per 1,000 people is 2.16. In Brampton, it's only 0.96. This new hospital will go a long way to ensuring that Brampton residents receive a fair deal. This is an absolute home run.
And now Dr. Navid's resignation has created more red flags in this situation. Has he been asked to resign or he quit himself? It is still not clear. But what is pretty clear now is that Brampton's health system is crumbling and the government needs to act quick before the health system in the city of Brampton completely collapses.